Good morning, everybody, to those here at our event in person at the Visibility Building and also to those online. Welcome to our last Ready to Listen session. I'm Louise Forster, CEO of Advocare, and I'm afraid I'm an apology for being there in person. I think COVID has, like everyone is aware, has disrupted our ability to be there in person, more than one of us. So just apologies for that. My very capable colleague, Shawnee Van Poteren, is and doing an amazing job of emceeing today's event. But before we start, I'd just like to acknowledge the traditional owners of the land. So we at Advocare, who walk alongside the older persons throughout Western Australia, would like to acknowledge and respect the Whadjuk people of the Noongar Nation, where our office stands. We also acknowledge and respect all older persons from other parts of this vast state and across the country who live and work in the regions. We acknowledge the traditional custodians of this country, and we respect their connection to land, sea, and community, and pay our respects to their culture and the elders past, present, and emerging. Little bit of housekeeping for those of you in the building. If we have an emergency, please follow people with the warden hats on. If you need bathrooms, they're outside the theatrette and you can ask the staff for directions. In the building at the moment, we're still wearing masks. I'm sure you're aware. If you can just keep those on when you're outside the theatrette. And if people can turn their phones on to silent, we'd really appreciate that. And I'll hand over to my colleague, Shawnee. Thanks, Shawnee.
Thank you, Lou. Thank you to everyone that's joining us online and everyone here in person. It's lovely to see you all. Just a bit of a background about the Ready to Listen, Be Ready to Act series. Today is the third and final instalment, and our first session on Wednesday last week was delivered to the community members to raise awareness about elder abuse generally, but with a focus on sexual assault. With a focus on sexual assault and how ageism and ableism remain at the forefront of that. While the second webinar, which was hosted online to residential aged care providers, it was all about education and practical strategies to improve responses to sexual assault disclosure and to prevent sexual assault in residential aged care. So today is about continuing that conversation about sexual assault in older people. So now is a perfect time to introduce you to all 5 members of our panel. The panellists today no doubt have spent many a waking hour and dedicated their time to ensuring older people who are experiencing or at risk of experiencing elder abuse, particularly sexual assault, are listened to, validated and supported. So firstly online, I will go through in no particular order. We've got Dr. Catherine Barrett. And Catherine is the founder and director of Celebrate Ageing, a charity challenging ableism, ageism and building respect for older people. Catherine has been an advocate for preventing sexual assault of older women for the past 25 years and currently coordinates Ready to Listen, a project preventing sexual assault in residential aged care, which is in partnership with the Older Persons Advocacy Network and the Older Women's Network in New South Wales. Also joining us online is Dr. Barbara Blundell. Barbara is a senior lecturer in social work and research academic in the School of Allied Health at Curtin University. Barbara's research interests have a particular focus on ageing and disability issues, elder abuse, human rights and advocacy. Barbara was also one of the first advocates to work with Advocare when the organisation came into being 25 years ago. And joining us in person today, we have Margot O'Byrne. And Margot works with Tuart Place, an organisation based in Fremantle that supports and advocates for all former care leavers, such as Stolen Generation, Forgotten Australians and former child migrants. Margot also has more than 30 years experience as a facilitator working as a consultant with the WA Department of Environment and Conservation. Margot's worked throughout Australia and beyond with diverse organisations and institutions including government agencies, not-for-profit groups, Aboriginal groups, universities, farmer groups, people with lived experience of mental health, rural health services and older people. We've got Kylie Lawton on the end, and she is currently the manager of Sexual Assault Resource Centre in Perth, WA, that provides health, counselling and forensic services to people over 13 years who have been sexually assaulted. She is a qualified social worker with 25 years experience in the health industry. Kylie has worked clinically in a wide variety of settings, including emergency medicine, community mental health, child protection, and in acute medical surgical services, including the WA State Burns Unit. And in the middle, we have Varney Poinan, and she is currently a solicitor in the Civil Law Division of Legal Aid WA. She has over 13 years of experience working in a range of civil law practice areas, including employment law, migration law, criminal injuries compensation, and abuse in care, personal injury matters. In 2020, Varney started working in the Senior Rights and Advocacy Service within the Civil Law Division. This service has now been absorbed into the larger Elder Rights WA service that provides wraparound legal services for seniors and older people statewide. So as you can see, we have a wealth of knowledge from all 5 panellists, and I can't wait to ask some of the questions that we have for them today. Just a little bit about the questions. These questions came in different ways. They were submitted by registered attendees prior to today's session. We also gathered them during the first 2 webinars. And of course, any live questions that anyone has today, both in person and online, we're willing to take as well. Please note, during the series, we understood the sensitive nature of the sexual assault topic. We made sure that all questions that have been collated anonymously and will be responded to in a summary at the end of the series for all to access. When that is ready, participants will receive an email, and that will let them know that the questions and the answers will be available on Advocare's website. So I'm going to throw to some of the questions in no real order, mix it up a bit so we can have a conversation. And please know to all our panellists, even if the question isn't poised at you, please feel free to jump in and add a bit so it's more of a discussion rather than just me asking and answering. So that would be great. So the first one is to you, Catherine. Can you please explain a little bit about what the Ready to Listen project is, and if the training is available to people outside of residential aged care, for example, community or practice nurses who are involved with accessing or involved with caring for older people?
Yeah, sure. And just to acknowledge, I'm coming to you from the lands of the Dja Dja Wurrung people, and I want to acknowledge their elders, past, present and emerging, and just to acknowledge as well to Louise, Tara and Shawnee and Serena for pulling this event together. There's real leadership here in doing this, in actually speaking out on a topic that we've ignored for such a long time. So I want to acknowledge that as well. Ready to Listen came, I think you could say it came from the Royal Commission into Quality and Safety in Aged Care, which identified 50 sexual assaults, estimated 50 sexual assaults in residential aged care each week, and called it a national disgrace. And then in the time after that, we had the introduction of SIRS, the Serious Incident Response Scheme, and with that came for the first time mandatory reporting. So all sexual assaults need to be reported. The Aged Care Quality and Safety Commission developed a fact sheet on sexual assault. And so there was real interest in and momentum for doing something about this issue that has been there for far too long, and we've done really not very much at all. And consistently across the board, what older people and their families tell me is that when someone reports that they've been sexually assaulted, that service providers and family members don't listen. And so the idea of Ready to Listen was that it takes more than just giving people education. We need organisational change on this, and we need to give service providers the education, the information and the resources so that they really understand what sexual assault is about, and then they are ready to listen, then they're ready to provide the support, then they're ready to do the prevention. So the Older Persons Advocacy Network is leading this. I'm thrilled to be coordinating it. And what we've done really is develop education and resources to help service providers deliver education in their own workplaces, policies, audit tools, guidelines for reporting to the police, those kind of really practical resources that we've never had before. And that has been a real barrier to appropriate responses and to prevention. So that's what the Ready to Listen has been about. A national approach focused on residential aged care to build leadership across the country and to really stop. One sexual assault is one sexual assault too many. So it's about resourcing and building capacity for change.
Absolutely. Thank you, Catherine. So, Kylie, I'm going to throw to you now for the first question that's been posed to you. What services does the Sexual Assault Resource Centre provide, and how can people access it?
Okay, so the Sexual Assault Resource Centre, SARC, is a Department of Health service that's run through North Metropolitan Health Services. We are quite closely aligned with King Edward Memorial Hospital and with the Women and Newborn Health Service in Subiaco. We offer three parts to the service at SARC. So the first thing that we have is a well-trained education and training department whose job it is to provide education to all parts of Western Australia, both professional and to the community, about responding to sexual assault, about how to manage the impact of experiencing that trauma, and how to manage vicarious trauma, because it is distressing to hear people talk about sexual assault. And we do a range of both standardised and bespoke education and training packages to a range of different professional bodies. We speak to the universities during O Day, we speak to health professionals in the community and in the public health system, we speak to schools, we speak to teachers, and we do education for residential care workers, and we have in fact run a number of sessions for residential aged care workers who've come in and toured our building and spent time learning about our service and what we provide. The two clinical divisions that we offer are an extensive medium to long-term therapy service that looks at providing up to 26 weeks worth of therapy to people who are requiring recovery from trauma. So that is a service that is available free of charge with no requirement for Medicare or any other funding input. That allows people to access a team of social workers, psychologists and clinical psychologists and seek trauma recovery therapy for experiences that they've had across their lifespan. So that might be someone who's experienced child sex abuse, it might be someone who's recovering from a more recent event. The part of our service that people get very interested in, and perhaps the part that is of most interest to the Ready to Listen program and the residential aged care services that are starting to move through the training package that Ready to Listen offers, is our medical and forensic service. So we offer a multidisciplinary medical and forensic service to people who have experienced a recent sexual assault. That team is run by doctors, nurses, social workers and psychologists, and they work together to provide medical care and to conduct forensic examination and take specimens from someone who has been recently sexually assaulted and who might be considering going through a judicial process. So if you're interested in following charges through the police, or that needs to be a report made through the justice system regarding a recent sexual assault, we are the service in Perth that offers forensic collection of specimens of evidence that might be on your body. So our service operates with people who have been sexually assaulted within the last 2 weeks. And that's a very tight time window for people to be coming to our service. You need to know that it happened, you need to access our service and come in to us within a 2-week period. The reason for that is that forensic evidence that is collectible and usable in a court of law has varying degrees of decay. So it's actually not viable to take forensic examination from someone longer than 2 weeks after their examination, after their experience. It is a challenging working environment because people often feel that they should be able to do something a bit more for a longer period of time, and it's one that we have to very individually assess for the person. So, for example, different types of sexual assault, and this is where I show myself up as a social worker who works in a fairly gory area. Different types of sexual assault affect forensic evidence in different ways. Digital penetration with a finger has about a 24-hour opportunity to collect evidence from. However, penetration with a penis, particularly if there's ejaculation involved, can last for 2 weeks. So we have to assess the immediate concern for the person who's been assaulted and offer something that's individually appropriate to them. Our doctors work really hard to cover off medical issues like STI exposure and a range of other medical concerns such as unwanted pregnancy. And we work as a multidisciplinary team to manage crisis support and to provide counselling, short-term counselling to people who are going through that experience. That particular program is probably the bit that we are most well known for in Perth. So if you think about SARC, we are the Rape Crisis Service of Perth, and we are the service that most people, if they know of a rape crisis service in Perth, they know about us. What is particularly challenging for the field that you're all working in is that we see people ranging in age from 13 onwards across the lifespan. There is no upper limit on people that we will see at SARC. 48% of the people who come to SARC for a recent sexual assault are under the age of 24. And in fact, only 2% of the people that we see at SARC are older than 75. And that is a shame, because that suggests that that people who work with the aged are not aware that they can call our service and talk to us and get indications for support and for future management of that scenario.
That's incredible about it. It goes to reason what we're talking about, that older people that are sexually assaulted, whether they be in the community or is it in residential aged care, for many reasons aren't coming forward and getting the support that they need.
Yeah.
So following on from that, Kylie, and thank you for that fantastic overview. Margot, I know that you work with people who have experienced significant trauma, particularly in the past. So can you please explain what Tuart Place is and what services it provides to older people?
Sure. Okay, so Tuart Place is a centre in Fremantle in Western Australia that is a support service for people who were in out-of-home care when they were children. So that's commonly a term for that is care leavers, but it includes former child migrants, of which we have approximately 7,000, stolen generation, of which Australia has approximately 50,000, and alarmingly 400,000 forgotten Australians. So, and I identify as a forgotten Australians. I was also in care when I was a child. People who have been in that situation have complex childhood trauma. This means that the trauma that you experienced as a child, which strangely enough wasn't listened to either, comes with you for your whole life. And so Tuart Place supports people through therapy, through counselling, but also through social networks, through activities groups, through the opportunity to take out redress. Quite a number of people have gone for redress, but more importantly, and this year we've been able to provide care navigation services for aged care, because most of the people who attend Tuart Place are certainly well and truly over 55, but mostly over 75.
Absolutely. So on the back of that, obviously being institutionalised as a child and suffering horrific trauma, including sexual assault, when older people get to the stage that they might need to enter residential aged care, what are their thoughts? What are their biggest fears? How can they be supported if they need to make that leap from the community into residential aged care?
In order to do that, they have to be incredibly supported. The most common phrase that people will say is, if I have to go into an institution, I'm going to kill myself. And it's not a throwaway phrase, because the fear of going back into that situation where you have no control, no agency, no ability to make choices for yourself, and quite possibly are going to be sexually assaulted again, and have no one believe you if you did actually tell someone that, is triggering, and it's re-traumatising. And there's a lot of assistance has to go on to enable people to, because also too, they have a memory of huge, awful institutions where you didn't have any choice. So even if the situation now is quite different, people haven't necessarily brought that picture together again.
Of course. Thank you so much, Margot. So, Barbara, thank you for joining us online today. Can we please ask, what can the tertiary education sector do to prevent and respond to elder abuse in terms of teaching in regards to aged care?
Thanks for inviting me today, and I'm sorry that I'm in COVID ISO, so I can't be there in person as well. So it's interesting perspective coming from the university sector. As you know, as you mentioned, I did start off as an advocate at Advocare way back when I finished my social work degree a very long time ago, and that's where I've had this enduring, I guess, interest and passion for working in the area of older people's rights and advocacy and elder abuse as well. So I do feel a bit removed in some ways from the coalface of things going on out there. But my work in Curtin at the School of Allied Health, I suppose, I do teach a unit around social work with older people, and I do make sure that my students are very much exposed to older people's rights, the ideas and principles behind that, and as well as elder abuse and what happens there. So I make sure that they do have that foundational knowledge when they go into practice, no matter where they're going to work, that they can recognise and have some ideas about how to respond to that. I think that's quite important. We also teach a unit in social work called Violence, Abuse and Trauma, which covers off on a lot of different aspects of across the lifespan of how people are affected from, childhood to older age. So those things are quite important. Other things that we work on, of course, are research and trying to contribute to evidence-based practice. So I've done some work with Advocare and other organisations over the years. I have a current PhD student who's looking at violence and abuse against women across the lifespan, and she's recently written a paper comparing how sexual abuse is conceptualised and understood and responded to from childhood, where it's very mandatory, where people are horrified and victims are very innocent, to older age, where it's looked at a bit differently and a lot lacking and sort of seen as it does not happen as much, where we all know that evidence has come out more recently from the Royal Commission that that's unfortunately not the case. So we can contribute in those ways in the university sector and work with others.
Thank you so much, Barbara. Fanny, this question is for you because I know working at Advocare and answering the WA Elder Abuse Helpline, a lot of the questions we get asked require legal advice or expertise. So in regards to your role at Elder Rights WA now, can you let us know what legal services exist to specifically support older people, and if so, what you can do to exactly help their needs?
Sure, thank you. So I'm from the Elder Rights WA service. It's so Legal Aid has got the Civil Law Division, and the Elder Rights WA team sits within it. So we are able to pick on the expertise of various different professionals that work within the Civil Law Division. So for our service in particular, what happens is we do get a lot of financial abuse questions. It's quite rare that we get an elderly client calling for help because they've been sexually assaulted. However, I must say that it is something that we can advise on, because at Elder Rights WA we believe that we should be able to address all forms of elder abuse, and one of them, obviously, per the definition of elder abuse, is definitely sexual assault. So we do have the broader Civil Law Division, and if I can just step away from the main type of work we do, for clients who have faced sexual abuse, it is quite important that it's documented with perhaps like the help of the Sexual Assault Resource Centre, because the client may potentially have the ability to make a criminal injuries compensation application. And for this to happen, it is preferable if it's documented somewhere. Okay, so it is not always the case that you do need to have a police report before you can make a claim, but generally that is the expectation. So clients should seek advice on if they've faced sexual assault, or you believe that your elderly parent or your grandmother or someone has had sexual abuse. We suggest that you ring Elder Rights WA, the Legal Aid hotline, for legal advice, because there is a potential that they can make a claim for criminal injuries the maximum amount is $75,000 for one offence, and then if it's a series of offences, it can go up to $150,000. Now, if the person dies, the claim stops. So if you've made your application and someone is deceased, you cannot then, the funds will not go to the estate. The entire amount has to be gotten before the person is deceased. So for older people, that's something to bear in mind. Once the application is made, which is quite a lengthy process because there's a lot of documentation, evidence that you've got to supply, medical evidence, and the amount of the compensation is for how much injury they've suffered. It's not for how horrific the crime was, but what is the injury to them. So all that takes a bit of time together, and then after that, by the time you when you put in the application, the Criminal Injuries Compensation Office, which makes these decisions, is basically a sort of the equivalent of a tribunal or a magistrate's court. They generally take about 18 months, and we've actually, because in the Civil Law Division, we did used to do a lot of criminal injuries cases, and we've realized that in the length of time, some people do tend to die, unfortunately, and the money cannot go to the estate. So if the award is made before the person is dead, then the money can go to the estate. But if the award is not made before then there's a problem. So I'm just raising this so that people are aware that there is a time factor when it concerns elderly people. And the other thing, of course, is elder abuse is essentially a thing where people's wishes and rights are not respected. On top of abuse, often people are not respected for their wishes. So we provide a very client-focused and client-centered service at Elder Rights WA. So essentially, it's a free legal service for people over the age of 65, and also for CALD, culturally and linguistically diverse clients, and First Nations clients who are above the age of 55. So you can ring us, and we do get a lot of referrals through Advocate. So if they ring us, we can basically assess whether we can assist them. Otherwise, we'll plug them in with someone else who can. And we are now providing a very holistic service. So we have social workers on board who've really helped to make it into a holistic service. So we treat not just the legal issue, but all the other issues that people come to us with.
Perfect. Thank you, Vani. It's interesting you say about the time frame and when there's a criminal compensation. And we do know, and I'll throw to Catherine in a minute, but we do know that when older people are sexually assaulted, particularly in residential aged care, from the time of the sexual assault to the time of them passing is normally about 12 months. So they probably would miss that window of opportunity if it was taking that long. It's not for every person, but they're the statistics that Catherine can speak to a bit more when I throw to you now, Catherine. So this is a question that I received after our residential aged care provider session last Thursday. As we all are well aware, sexual assault in residential aged care is still occurring far too often. Why are there no consequences once a situation has been identified and reported? I personally found the Residential Aged Care Facility and the Aged Care Quality and Safety Commission handle my formal complaints in an inefficient and unsatisfactory manner.
Yeah, well, I think that's a really incredibly important question, and I think what we need to do is, and we'll do this increasingly as change happens, we'll increasingly look back and see much more clearly that we got it wrong. Over the last, I think, over a 10-year period, we gathered data and reported on it in the report on the operation of the Aged Care Act on compulsory reporting in residential aged care. So that was sexual assault by someone who did not have a cognitive impairment. And what we know from one of the really important reflections on that is that we gathered that data for a decade on sexual assault in residential aged care, but it's not evident that it was used in any way to inform prevention. So again, for a decade we gathered data on sexual assault in residential aged care, but there weren't strategies for education or change. That's part of the problem, that we have conceptualise sexual assault in residential aged care as a lesser crime or no crime at all. And I think this is ageism and ableism, and it's also sexism. And we know that KPMG research, so many people know that KPMG research that showed that in 58% of sexual assaults, one study found, staff thought there were no negative impacts from sexual assault. So sexual assault of older people in residential aged care, by and large, is not being conceptualised as a problem. And we have done so little for such a long time. And, you know, one of the conversations I've been having with the Aged Care Quality and Safety Commission, who are now in their fact sheet saying all sexual assaults need to be reported as a priority one, but in the decision tool, that online tool that allows you to click through a series of options, gives you the option to say sexual assault by a staff member, no adverse impacts on the victim survivor, didn't report it to the police, priority 2. So I think what that does is that reinforces a message that this is a lesser crime, that it doesn't really matter because they're older people or they've got dementia and they'll forget or they'll recover. And, you know, I think that some of the panellists will know that it takes a lot of skills for someone who works in a sexual assault service to actually assess the impacts of sexual assault on a person and to determine the level or extent of impacts. And, you know, there are controversies about rating impacts. You know, we don't think about sexual assault in a kind of a hierarchy of that was bad and that wasn't. One sexual assault is one sexual assault too many, and we need to do more to prevent it. But we've got to change our mindset and our systems, not just in residential aged care, but in sexual assault services. It's wonderful to see SARC on board. We need services like SARC in every state and territory, services that are saying, you know, we want change and we're here to help. But law courts as well too, and police services and family violence services. And it's across the board we need reform to support older people who experience sexual assault. So there is this conceptualising of sexual assault as not really bad, and that's wrong. And so that's why we've not done enough. That's why, you know, sexual assault is being reported, but we haven't done enough to create change. But what we have now is education, and what we need to do now is to really stop sexual assault from happening at all. We need to provide more support to people when they experience sexual assault. Absolutely. You know, in my 25 years of advocating, and, you know, hundreds of stories of sexual assault that have been shared with me, I could probably count 1 or 2 times when the victim survivor was offered access to a sexual assault service. And we know that sexual assault services do the most incredibly important work. For anyone who's seen Margarita Solis's film, when she talks about being sexually assaulted at the age of 95 and accessing a sexual assault service, it transformed her experience. So there is so much work to be done, and it needs to start now with education, resources, capacity building, but not just at that level of residential aged care services. The whole system of responses needs to be reformed.
Thank you, Catherine. With the Ready to Listen project that you've done, the resources that have come out of that can only benefit every residential aged care facility in the country. So hopefully we get the inroads to be able to provide that training and education face-to-face where possible.
May I make a quick comment there in regards to Catherine's stimulated my cortex. One of the things that we've seen at SARC is that we do see both people from residential aged care and people who are living independently in the community. And one of the things that we see for those people who are living independently in the community is that the press, the media, the public get very outraged by the idea of home invasion for elderly people. One of the significant impacts of being sexually assaulted in a home, particularly by a stranger, is that the elderly person in our agency, the people we have seen, have rarely been able to maintain their independence after that event has occurred. So they end up in care, they don't go home because they don't feel safe in that environment. It's in a way, it's great that we do have that kind of media and press response that says home invasion is a terrible thing for elderly people. But what we ignore is the terrific amount of abuse that happens at the hands of children and family members. And we found that, we find that across the spectrum of how sexual assault is covered off, even with the Royal Commission into institutionalised child sex abuse. Family and incestuous stuff was ignored by that Royal Commission in favour of looking at institutional responses to child sex abuse that's occurred outside of the family. We have this great hidden misogynistic taboo that says that sexual assault doesn't happen in families. It doesn't happen. We're horrified when we hear that. We can't believe that. We can't process that. We're able to maintain outrage as a community around stranger assault. Stranger assault in Western Australia at this point in time, statistically speaking, stranger assault represents less than 15% of the sexual assault that happens across birth. Most people are assaulted by someone they know. Most people are assaulted by someone that they actually have some kind of long-term relationship with. And in fact, one of the most dangerous people to you is the person who you are reliant on for your care.
Thank you, Kylie, very much. That's everything that we've been talking about for particularly the last week, but leading up for the 6 months. It's when we go out as an organisation, we speak about elder abuse in general. People don't want to hear that the people that we live with or the people we gave birth to or the people that we love and care for have abused us in any way, shape or form. So thank you for raising that point. Just on what Catherine was saying before and going back to the people that you help. So in regards to people with no legal decision-making capacity anymore, and unfortunately they are the more vulnerable people in the community and residential aged care. Most of the people that are sexually assaulted in residential aged care do have dementia or cognitive impairment. If a resident has been sexually assaulted and they do have dementia and no legal capacity to make their own decisions anymore, how does SARC support them, and can you support their guardian in regards to helping support them?
Yes, we can, and we do work in that scenario fairly regularly. There are a couple of, because we have several parts to our service, there are a couple of different ways that we can operate in that space with people who have decision-making disability. In the first instance, in a recent sexual assault, one of the requirements that we have is to determine whether someone can consent to their sexual assault examination. So both the medical and the forensic examination are, they require quite significant consent. And in fact, if any of you have ever had contact with SARC, you'll probably find that the consent documents for SARC are actually longer than your average surgical procedure consent form, because we do nothing to you without you. So you need to be able to consent for both legal purposes and also for your own peace of mind about what service we're offering to you. When you have somebody who has to make that consent decision on your behalf because you are unable to, we also require assent, because the worst thing in the world is to have somebody do something to you that you don't want when you have just had somebody do something to you that you did not want. And so in order to provide that layer of support for people, we work with quite closely with Guardians and with the OPA to obtain legal consent for a forensic and medical examination, but we will also work with the person to determine how much they understand about what they're offering. We require assent from that person, and we will also be talking to that person about, tell us when you need us to stop, put limits on what you can tolerate. If it's too much for you, we will not continue, because we do not want to further the trauma that you've experienced through that experience. And that's a really important part of how we work with recent sexual assault for people with cognitive impairment. From a therapeutic perspective, we operate realistically from two kind of potential diagnostic perspectives from a mental health perspective. We work with acute stress disorder and we work with post-traumatic stress disorder at SARC from a therapeutic perspective. For people who have decision-making limitations or have cognitive impairment, post-traumatic stress disorder trauma therapy may not necessarily be the most appropriate way for us to support someone. So we may not necessarily offer trauma recovery therapy to someone who has a cognitive impairment. But we can and do work with people with acute stress disorder. We do work with people around containment and around managing triggering events, and we work with them around mindfulness and support, and we do that in a short-term way to enable them to kind of exist in a bubble within the context of their experience without being able to pursue that kind of longer-term trauma recovery. There are other agencies in Perth that work with people with disability around sexual assault and sexual education, and they do some trauma recovery, although it's quite limited. Our service is not able to provide that longer term therapy, but we do function in that space of trying to help people to contain their experience and manage acute stress disorder.
Thank you, Kylie. I think the time has run out for the formal questions, but I would like to invite any of the panellists for any last comments, or would you like to speak to anything that another panellist had said before we wrap up today's event?
Look, I'd just like to congratulate you all. I think this is such an incredibly important step. And one of the things that's really powerful here is the organisations and the people that you're bringing together in the room. That really positions you well to create change. I think one of the things that I do want to respond as well, just by saying that no one wants to believe, or no one wants to think that anyone would sexually assault an older person and an older person with dementia. That's just, that's unpalatable to almost all of us. But that doesn't mean it doesn't happen. And I speak to a lot of service providers who say, we're so lucky that doesn't happen here. And I say to them, this has got nothing to do with luck. This is about processes and policies and education and building partnerships, meeting these fabulous people who are providing services in your state and territory, working together, and that places you well to create change and to prevent it from happening.
Thank you, Catherine. Barbara, do you have any last comments?
Nothing really springs to mind. I'm just grateful to, like, as Catherine said, know that there's such wonderful work being done in this area. I'm really encouraged by the work that you've been doing. And, Catherine, you've been doing this for a very long time. So it's really great to see that it's developed and grown and now out there in all these facilities and people are taking that on board. So congratulations for that work. And thank you to Advocare for bringing us all together today as well.
Yeah.
Thank you, Barbara. Thank you for joining us in COVID isolation as well. We really appreciate it. Kylie, is there anything else that you would like to say?
No, thank you. Thank you for having me.
Excellent. Barney?
Well, look, you raised the issue of capacity, so I'll just quickly say that we also provide representation at the State Administrative Tribunal if someone's lacking capacity. And so, again, you can ring Advocare and you will refer clients to us for representation at the State Administrative Tribunal if required. And that can be another sort of pathway for the elderly person to have to go through, essentially.
Perfect. Thank you so much. Margot?
And just one thing, because people who are care leavers are likely to be flying under the radar and not tell you and not say so, they're often quite quiet and may have different behaviours. So I'd just like to bring people's attention to this Real Care second time round, which was done by Helping Hand in South Australia, and it's got quite a lot of resources here, and you can access those by getting onto the Helping Hand website.
Thank you very much. So today we've spoken about a much needed topic that we need to we'll continue the conversation further from today. We will at Advocare keep on working with all of the organisations here and the people in the room to make sure that older people are supported and safe. So on behalf of Advocare, I would like to sincerely thank everyone on the panel for generously sharing their time and expert knowledge. And to everyone joining us in person and online, a big thank you also for continuing the conversation with us and being ready to listen. Just to reiterate, any questions that haven't been answered today will be collated and put on our website in the coming weeks, in about a week or so. And I would like to thank you again just for joining us, and have a great day and take care. Thank you.